Welcome to Connective Care Education. In this video, we will be looking at the content for Unit 003, Learning Outcome 13, Mental Ill Health. There is no health without mental health. World Health Organization. The well-being of individuals is dependent upon good physical and mental health. Mental health impacts on the overall well-being of an individual and refers to emotional health and well-being. Mental health problems range from daily worries and anxieties to serious depression and suicidal thoughts. Many individuals have mental health problems and worries from time to time. A mental health problem becomes a disorder or an example of mental ill health when it has ongoing signs and symptoms which cause considerable distress and affects day-to-day functioning. It affects the way that individuals feel, behave, and interact with others. Some periods of mental ill health may be temporary, while others cause persistent and long-term difficulties. Examples of conditions that indicate mental ill health are depression, anxiety disorders, schizophrenia, eating disorders, addictive behaviours, bipolar disorder, sometimes called manic depression. A mental illness can cause problems at home, school, work, and in relationships. Mental illnesses often come in episodes with periods of good mental health in between. Good mental health gives resilience to cope with difficulties, good relationships with others, a sense of control, and the ability to make decisions supporting well-being. Some physical conditions, such as long-term illness and disability, impact on mental health. Mental ill health can impact on physical health. Depression has been found to impact on coronary disease. The impact of mental health difficulties can be as great as physical health difficulties and has a significant impact on self-esteem, confidence, and well-being. Factors that can contribute or lead to mental ill health. A number of factors can contribute or lead to mental ill health. Low self-esteem, lack of confidence, genetics, many mental illnesses run in families, abuse including neglect, family breakup, dysfunctional family life or structure, life changes, for example, separation, divorce, unwanted career change, bereavement, physical illness or injury, brain injury, head injury or epilepsy, poor nutrition, poor social skills and ability to relate to others, experiencing discrimination, poverty and debt, long-term stress, unemployment, poor housing or homelessness, drug and alcohol abuse, caring responsibilities, domestic violence, bullying, trauma, for example, accident or military combat. Potential indicators and signs of mental illness. There are many forms of mental ill health, but what each has in common is that they all affect an individual's personality, thought processes, and interactions with others. Potential indicators of mental illness include change in behaviour, change in sleeping habits, change in eating habits, unkept appearance, drug or alcohol abuse, expressions of sadness or suicidal thoughts, lethargy and low energy, unable to concentrate, appearing confused, becoming isolated and withdrawing from friends, family and activities, unable to deal with daily problems and stresses, change in sex drive, excessive anger and violence, emotional outbursts, expressing feelings of guilt or worthlessness, self-harming behaviours. Please pause the presentation here and complete worksheet Unit 003, Learning Outcome 13, Worksheet 1. Ways in which individuals can be supported to live well with mental ill health. Individuals can be supported to live well with mental ill health by encouraging them to access services and support and develop positive and healthy lifestyles. However, there is no one-size-fits-all when supporting an individual with a mental illness. What may work well for some may make others feel worse. It is important to talk to the individual and find out what will help them. Some examples of the help they could need include encouraging talking to family and friends, regular health checks, spotting early warning signs of periods of mental ill health, being in control of medication and making decisions about medication, looking after well-being, learning to recognise triggers for periods of mental ill health, local support groups, accessing counselling services, therapies, for example, art therapy, exercise, mindfulness, regular sleep patterns, healthy diet, drug and alcohol support, encouraging learning and new skills to give confidence and boost self-esteem, helplines, for example, Samaritans. Positive outcomes associated with improved mental health and well-being. Improved mental health and well-being brings positive outcomes for individuals, resilience to cope with difficulties, increased employment, less days off sick from workplace, improved physical health, less risk to health problems such as cardiovascular disease, good relationships with others, ability to think clearly and make decisions, sense of confidence and control, the ability to take on new challenges, increase in productivity, for example at work, reduced drug, alcohol, smoking dependence brings health benefits, improved sleep patterns. There are a number of charities and organisations that offer advice and support to individuals suffering from mental ill health and the families that care for them. Charities and organisations: Mind Cymru, Mental Health Foundation, 1,000 Lives, Mental Health Foundation, Mental Health Wales, Time to Change Wales, Hafal, and helplines. Please complete worksheet Unit 003, Learning Outcome 13, Worksheet 2. Please submit completed worksheets to your assessor and move on to the next video, Unit 003, Learning Outcome 14, Substance Misuse. Thank you for watching.